If you have a hiatal hernia or you suspect hiatal hernia syndrome, I'm often asked, is back pain associated with this? And this can be upper back pain, mid back pain, lower back pain, but as I said, I'm often asked, is that a common complaint? And it is, and you should know why, because it very much has to do with the underlying root causes of hiatal hernia syndrome. So the first thing we're going to talk about is the diaphragm. And the diaphragm is a dome-like organ that is just above your stomach. And when you inhale it, it bows down, and when you exhale, it bows up. But it's a very vast organ. We don't appreciate how large it is. So as I said, it's just above your stomach, it's just below your heart on the left side. And so what happens is that when you get irritation to the diaphragm, because the stomach has compressed and it's pushing up on it, what happens is that dysfunction or that irritation also reflexively irritates the nerve going to the diaphragm. So the primary nerve going to the diaphragm is the phrenic nerve, and that's spelled P-H-R-E-N-I-C. And the phrenic nerve goes to the diaphragm, as I mentioned, but it also goes to your neck and shoulders and middle back. So what happens is that reflex can, the diaphragm is irritated and it's sending that impulse back to your brain through the nerve, and but that nerve gets irritated, and then you also can get muscle muscle irritation primarily, sometimes joint irritation, and so you get this neck, upper back, middle back pain. And so that reflex is very similar to what you hear about when somebody's having a heart attack, and what do they tell you to kind of be aware of? You can have pain down your left arm. Why? Because your heart's on your left side, and the level of nerve that goes to your heart also superficially sends nerves down your arm. So that's the reflex. Also, jaw pain is associated with a heart attack. Same reason. So hopefully that makes sense as to one reason. The next reason is that when you're having a lot of acid reflux, you can be bent over, you're in pain, you're having trouble sleeping, and these odd postures can strain muscles, and then you get anywhere from neck to, again, trapezius, the shoulder muscles, mid back, lower back. All of these things can be affected just due to the postural changes of you having so much discomfort. Next is having to do with your stomach and esophagus being irritated. So of course the stomach is being compressed and acid is going up the esophagus, and the nerves, just like we were talking about with the diaphragm, the nerves that go to the stomach and the esophagus also go around to that middle back area. So here's another reflex that has to do with the structural aspect of things. So it's really quite fascinating how your brain controls your body, and through the nervous system we have these deep channels of nerves that go to organs, but then on the same level of coming out of your spine, you have the superficial nerves that are going to your structural. So they call this somatovisceral reflex. Soma is just your body, so that's talking more about the structure, more about the superficial part. And then somatovisceral, the viscera are your organs. And so you've got these classic reflexes that people know, like the left arm pain with the heart attack, gallbladder attacks, refer pain into your right scapula, your right shoulder blade. It's because those nerves that go to the gallbladder also go to that area of your body. Women can be having bad menstrual cramps and they have low back pain. Same thing, the nerves going to the uterus are also going to the low back. So that's where this interplay comes from, and it explains why you can have these structural muscular irritations. And then last but not least, no, there's two more. There's also the bloating and pressure. So I talk a lot about the fact that with hiatal hernia syndrome, we have a lot of what's called increased intra-abdominal pressure. So within your abdomen, you've got pressure which is compressing the stomach and leading to the acid going up your esophagus. So it's doing that, but it's also creating pressure on your diaphragm, as we've been mentioning. And when that happens, your diaphragm is not functioning as well as it should. And so what occurs is ancillary muscles, they're called, sort of kick in. So we should be able to sort of beautifully belly breathe, right? There's people that breathe like this, so we call them shallow breathers or shoulder breathers, because they're not able to get that deep breath. So whether it's habitual or they're quite sedentary, or like in hiatal hernia syndrome, they have diaphragm issues, you get this ancillary muscles like the trapezius and even into the neck. They're doing the work. So then, and they're not supposed to do the work. It's supposed to be this nice deep breath that comes way down into your belly, into your diaphragm. So that's another source of irritation. And then the bloating, as I was mentioning earlier, that increased intra-abdominal pressure that's creating the bloating and the distension and the feeling like you're getting full right away and you can't really bend over to pick up something off the floor or tie your shoe without going, oh. Sometimes people regurgitate a little bit of acid, or heart palpitations can kick off, or severe shortness of breath. So that increased pressure, it's not just going in the front, it's going in the back too. So it's filling that whole abdominal cavity, and that increased pressure and irritation, because it shouldn't be there, is another means of aggravating muscles. So we have 5 different mechanisms that are potentially creating middle back, even into the lower back, neck, shoulder, pain and discomfort, that at its root is hiatal hernia syndrome. That's why part of our programs are that we not only deal with the internal imbalance of the gut, but we're also resetting the balance of the diaphragm, the associated muscles and nerves, particularly the vagus nerve, that is your longest cranial nerve that travels to your chest, your esophagus, your stomach, your heart, your entire abdomen, and all the abdominal organs therein. So that's why we have that 2-pronged approach, both the structural and the internal, because if you're really going to resolve this as needs to occur for full resolution and you to feel great again, you can't forget the structural component either. So I hope that explains how we can get in this situation of having back pain and knowing that it's not something different. It is associated with hiatal hernia syndrome. Okay, good. So I hope that explained it. And if you do like the content you see on this channel, please consider subscribing to the channel. We're really trying to increase our subscribers so that more people can see this information, because that's just how it works with the algorithm. And if you like the content, give it a thumbs up, share it with others, and that's how we can help more and more people. All right, I'll talk to you soon.